and welcome to this chess event. It's good that there's so many of you who is interested in the presidency situation. Chess, as you know, is the Coalition for Health, Ethics and Society, the health policy program in the EPC, supported by an educational grant from Johnson & Johnson. And my name is Hans Martens, and I'm the chairman of chess. So we all know it's been a very special year again now for health policy in Europe. The start of the year was dominated by new waves of COVID-19. Then came the vaccines, and the European cooperation really started on this area and in the distribution of vaccines, I think very successfully. Example of practical European cooperation. Over the summer, I think many of us were thinking, yeah, now it's all over. And now we are sitting here again behind the screens instead of sitting together in a cozy room in Brussels. So let's hope this will soon go away so that we can meet again and rub our shoulders. But the pandemic has also meant a lot more activity at the European health scene. We've got a new budget, you know, much bigger than we've had before. We have a lot of new roles concerning the pandemic, concerning preparedness for the future, creating resilient health systems, but also a lot of other disease areas, such as the Great Beating Cancer Plan. Yesterday, some of you might have seen there was a launch of a new version of Health at a Glance, the country reports and the companion report from the Commission, the OECD, and the European Observatory. And we'll put this under discussion in the beginning of the year at an EPC event. And again, I think the report and the discussion yesterday stressed how much better we are off if we share experiences and best practices around in Europe instead of reinventing the wheels all the time, as we sometimes are inclined to do in Europe. But at this point, where we change presidencies of the European Council, we normally have an event here at CHESS to take stock of what happened in the last half year and then look forward to the upcoming presidency. We have not been able to get a speaker from the Slovenian presidency, the outgoing presidency this time, because they're too busy finalizing the presidency program. So our colleague, Rayner, has promised to join us. He's policy analyst at EPC, and she will summarize what has happened over the last 6 months. And I think even including the Health Council meeting that was held last week, what are the main issues there? And then we are lucky to have with us also Constance Favereau. I think you are online with us now, who is health attaché on the French Perm Rep, and who is going to be very busy from January 1st. But I also have the feeling you're already busy now, and that you might have to leave a little bit before we end, before 12 o'clock. So if that's the case, we will pick up the discussion when you leave and do your important preparation job. But let's get on it, because we have quite a lot to cover. So I just start with the issue with Laura and the Slovenian presidency, what happened there, and what's in the oven for the French to start on the 1st of January. Laura, you have the floor.
Thank you, Hans. Just share my screen. There we go. Indeed, unfortunately, as you so neatly put it there, this has been yet another 6-month council presidency where COVID has taken center stage in the world of European health politics. And unfortunately also wraps up the 18-month trio presidency program of the Germans, the Portuguese and the Slovenians, which have all been dominated by COVID. So when defining their presidency program, Slovenians identified 4 key areas that they wanted to focus on in terms of their actions. They're written on the slide here, but in terms of the lists that were given of the policy areas underneath these topics, top of the list was building the European Health Union. Other health areas that were mentioned were the EU's capacity to ensure the availability of medicinal products and medical devices, and facilitating their research, development and production. There was also a clear emphasis on the proposal to develop a European Health Emergency Preparedness and Response Authority, such as the American BARDA. So how has this been in reality? What progress has there been over the last 6 months, and what areas of EU health policy has there been movement on, or indeed not? So in terms of the December Health Council, which took place last week, ministers approved the Council conclusions on strengthening the European Health Union. These conclusions highlighted 4 main priorities: innovative solutions for resilient health systems, accessibility and availability of medicinal products and medical devices, global health, and beating cancer. In terms of the discussion itself in the Health Council meeting, completely unsurprisingly, there was an awful lot of focus on the situation regarding COVID, particularly related to the spread of the Omicron variant. The discussion looked at what measures have been taken in the member states to contain the spread of the variant. And as has been a regular feature of European Health Council meetings for a while, there was also discussion about vaccination, in particular regarding a common approach to vaccine certificates, particularly in relation to the rollout of booster doses. How the vaccination programs are going in terms of boosters, but also child vaccinations, and also the challenge of fighting vaccine hesitancy. There was also some small discussion on the need to step up testing and sequencing of in view of the Omicron variant and any possible new variants, as well as joint procurement of therapeutics at EU level. The Slovenian presidency in the December Health Council also updated ministers on the successful conclusion of negotiations on 2 legislative proposals to build the European Health Union. These 2 are indeed a reinforced role for the European Medicines Agency and an updated mandate for the European Centre for Disease Prevention and Control. Both of the negotiations have been concluded, but it should be noted that the final adoption is expected in 2022 after the Parliament and Council have signed everything off. So in terms of the other health files that have been key activities in the Slovenian presidency, probably the biggest challenge for the presidency has been the European Health Preparedness and Response Authority, or from now on HERA. This has been indeed, as I said earlier, modeled on the Americans' BARDA, which successfully developed and procured COVID vaccines in record time. But HERA has provided a pretty clear example of the gap between member states' rhetoric and the reality when it comes to pooling health competences. In short, the EU needs to do much more to deal with pandemics, but not if it involves handing over too many more powers or member states losing any oversight in the meantime. HERA is in normal times expected to be responsible for health coordination in order to strengthen Europe's ability to prevent, detect, and then respond to cross-border health emergencies. HERA is expected to anticipate crises through intelligence gathering, building necessary response capacities, and as such will be tasked with developing a systematic framework to support the development, production, procurement, and equitable distribution of necessary medical countermeasures. But during a pandemic, it would get exceptional powers, including the ability to negotiate directly with manufacturers, procure medicines and materials, and reshore production capacity to the EU. These exceptional powers would be triggered by a council vote. The intention was for HERA to become a Directorate General within the Commission, but questions have been raised by member states regarding transparency and oversight, its levels of autonomy. So despite the best efforts of the Slovenian presidency, several countries, including the Netherlands, Germany, Spain, Italy, asked to delay the vote on the agency due to these concerns regarding their oversight. So as such, despite the intention for HERA to be fully operational from the beginning of 2022, this file remains one for the French presidency to take on in the new year. Finally, just some additional files that remain in progress. Europe's Beating Cancer Plan, as Hans referenced, it was launched in February this year, but the funding for its implementation has been delayed due to the late approval of the EU budget. However, with the view of the pandemic, there have been additional points added to the plan. Clearly, the pandemic has very clearly highlighted some issues related to prevention, detection, treatment, and survivorship. It should be also noted that, again, as the plan was launched in February this year, a lot of the activities are still at preparatory phase or undergoing impact assessment or are out for public consultation. In terms of the European Health Data Space, this was expected to be published in Q4 of 2021, but is now expected in 2022. And in terms of the European Mental Health Strategy, COVID has clearly had an enormous impact in terms of mental health. The European Parliament have been very vocal in their calls for a European mental health strategy. But aside from some references in the Occupational Health and Safety Strategy, which was published in the summer, specifically about mental health in the workplace, there's been no other significant progress on this point. So just to final comment that, as is so often the case with European health policy, this has definitely been a sort of 2 steps forward, 1 step back council presidency, and there certainly remains an awful lot that will be needing to be taken up by the French in the new year.
Thank you very much indeed, Laura, for this comprehensive overview. I think it was fairly precise, and I think you're rightly saying that some steps were taken forward. Some things have happened, but there's also quite a lot in the oven now to be baked by the French, which they're normally good at, by the way. So, Constance, welcome to you. You are looking forward to not only what you had planned, actually, but probably also to pick up some of the preparations that didn't really quite happen during the Slovenian presidency. So, let's hear what you have in mind. Constance, over to you.
Thanks a lot, Hans, and thanks again really for your invitation to participate to this event this morning. I'm very happy to be here and to have the chance to explain and maybe to answer your questions about our working program next semester. I'll be quite simple and basic, and I will structure my intervention in 2 parts. It's very, very simple. I will first maybe focus on the legislative files we will have to work on next semester, and then I will maybe give you some information about the different events we plan to organize next semester. And through these events, of course, we would like to highlight some important and interesting topics on which we think having a more coordinated approach would be interesting for citizens. So this is the two aspects I would like to address this morning. If I go to the legislative files, for us, it's really a key issue, and this is very important. And our president has recalled this statement last week. We have to deliver on the legislative files, and this is through regulation that we are able to put in place a solid structure in Europe. In the health sector, we all see that the crisis is not over, and we should put all our efforts in closing the current legislative file. So, of course, we will try to finalize the Union Health Package. We will support our Slovenian colleague until the end of the year because, the HERA file is still open. There are still ongoing discussion on this HERA regulation. We call it HERA regulation. It's not totally correct because it's not the exact name of the regulation, but it's a simpler way to evoke this file. So we will see, we will try to support our colleague until the end of the year to see if a solution, an agreement can be found. And of course, if no agreement is found, of course, we will continue the work on this file. Regarding the other regulation, which is open, the cross-border health threat regulation, we will continue the trilogue. A trilogue have begun in November, and some technical meetings are still ongoing right now, and we will really try to find an agreement with the Parliament on this, but I think we are sharing a lot of common opinion and views on this file, so I hope we will be able to find an agreement very soon. Beyond the Union Health Package, some very significant legislative files are expected from the Commission during the semester, and we will start the work on these files and do our best to really go as far as possible until June. This is very important because, as you may know, the working program will be quite heavy in 2022 because we are expecting from the Commission a lot of legislative files related to the pharma strategy at the end of the year. So it's very important for us to be sure that we are able to go as far as possible in this different text. So 3 texts should be published normally in the course of the semester. First, a regulation for the European health data space. It has been mentioned just before. For us, it's a very significant text because in France, we have set up a health data hub. So we have some knowledge and experience on this. And we think having this European health data space could be a very useful tool for the health of citizens. So we will start the work on this. We will also work on the directives for blood tissue and cells. The Commission is supposed to publish the revision of these 2 directives in the course of the semester. So we don't know exactly when, probably from March or April, but we are ready to launch the work and the discussion on this directive. And finally, we expect also from the Commission a regulation reforming the EMA fees system. It's a quite technical regulation, and depending on when this text will be published, we are also ready to start the work and to prepare the ground for our Czech colleagues for their presidency. So this is the main legislative files we have on our plate, and really the message from our side is to be sure that we are putting all efforts in these legislative files, because it's very important to present and to give to the people some results on this. Beyond the legislative files, and this is my second part, we will organize different events and conferences. And this is a way for us to highlight some important issues and topics and to launch exchange between countries. And on these topics, we think that a stronger European cooperation might bring added value and benefits for citizens. So I will maybe try to list these different events, and don't hesitate to interrupt me or to ask me any questions. So the first conference we will organize, it will be on the 18th of January, and it will be a conference on the resilience of health system. The angle here will be rather the organization of the health system and the way healthcare are provided to citizens. We won't address the issue of medical product availabilities. We think that this issue has been already addressed and worked in different forums and events. So here in this conference, it's really, the idea is really to focus on health system organization. So this is the first conference we plan in January. On the 2nd of February, we will organize a ministerial conference on health data. The idea will be really to work rather on ethics, and this is the aim is really to prepare and to have a common understanding of this quite sensitive issues ahead of the regulation, because we think that a lot of discussion will, of course, will take place around this sensitive issues of ethics and legal regulation of the use of health data. In Lyon, on the 11th of February, a joint event organized with the Ministry of Foreign Affairs is also planned, and the aim of this conference is really to have a common reflection on the way to strengthen and improve global health. So this will be a bit broader. At the end of February, on the 28th, we plan also to organize an event about rare disease. It's a very important issue in France. We were very involved in this area, in these files. We were expected maybe to have the revision of the 2 regulations on orphan and pediatric medicines, but it has been a bit delayed. It has been postponed to the end of 2022. but we really want to have this discussion all together, because we think that this issue, the rare disease, really needs to be highlighted and addressed. Finally, on the 7th of March, and this is also a bit related to, sorry, to HERA and to this Union Health Package, we will organize a high-level conference on antimicrobial resistance, on AMR, because this is also one of the big issues we are facing right now, and we think that a collective response should be set up to tackle this issue. So through these different events, we really want to open the debate and to have the chance to really get some exchange and exchange on best practices, reflection on these very interesting topics. These topics, unfortunately, are not addressed through legislative files. This is why we thought having conferences could be a good way to work on them. So this is it from my side, and don't hesitate to ask any question.
Thank you very much indeed, Constance. This was good to hear. The regulatory our area is quite big, and I think there will be enough of work for you to do on that. But it's good that you have time also to have the open discussions about the very important topics that you're mentioning. You mentioned the event on the 18th of January about resilience of health systems. You saw yesterday that we had a launch of Health at a Glance. I think a lot of the facts in there might be good to have in, because I'm pretty certain you will have 27 member states all claiming that they are doing the best in the resilience, but this is also, I hope, about how we can learn from each other, from the best practices, and so on and so forth. The issue there on the data, I think, is very important also in order to create. You talked about ethics. There's a question of equal access in relation to data, but probably also a lot of trust issues there as well. So global health is in rare diseases, it's all very, very important. So it looks like a very dynamic spring that we are going into. So can I just say that we now open, and Florence, Constance, can I ask, are you leaving? You have to leave us 11:45 or so? Yeah, so I think all the questions there should line up now, if there's any from the audience. But can I just start by asking you about HERA? I think it's starting a little bit later than we had expected, hoped for, whatever you like to put it. But I suppose, I mean, we're more or less clear about where the budget should be, the task, and also the tasks in normal situations and in emergency situations. But will it? It's being called an agency, but it is an authority. It's going to be a part of a general directorate, a part of the commission, not sort of an independent body, right?
Yeah, exactly. And the commission has made this choice for quite basic reasons. The idea was to have the chance to have an operational authorities very fast and very quickly. If you decide to launch an agency, of course, it will have take a lot of time. The regulation to settle this agency will have take a lot of time, and you would have faced a lot of debates about the location of the agency. And I think the idea for the commission was really to be sure that first to have very quickly an operational entity within the commission, of course, within the commission. And from some member states, it has been very disappointing, and it has been seen as a less ambitious project. From the French side, we were, of course, we would have been supportive of having a big agency such as the BARDA, because at the beginning it has been announced this way, but we also understand the necessity to go fast. We are still in the middle of the crisis. We will face some new challenges, and we will have to take again important decision. I'm thinking, for example, to the joint procurement of therapeutics. It is really in front of us, and we will have to have a common discussion. And from the French side, we think that having this internal entity, it's a good first step. In order to get organized and maybe to make this joint procurement together. But of course, in the future, we would be in favor of having something more independent and maybe having an agency. So, but I think this is a very personal point of view, but I think right now in the Council, this debate is a bit over. I think we are all aware of the fact that, okay, for now we have a kind of DG within the Commission, but we all know that the situation could evolve in the future.
Yes, indeed it could. And I think there's a very strong need for HERA actually to be operating, because it seems we're not really getting away with this COVID-19 and its mutations. So it seems that, well, get the work done is a good idea. Now, I have, Constance, some questions coming relating to the events. I think there was quite a lot of interest there. First of all, I have a question about the event on the 3rd of March, and maybe my notes was not precise about an independent, competitive and innovative European healthcare sector. That was one. The other one is, how can people register for the events? I think there's a lot of people who would like to join in. And the question is also from somebody else, which kind of stakeholders can participate in the Conference on Health Data in February? Is it only government, or can people from the outside join as well?
Okay, so if I go back to the first question on the event of on the 3rd of March, that's true. I haven't mentioned this event, also because it's a joint event between the Ministry of Health and the Ministry of Industry in Paris, and it's more led by the Ministry of Industry, and it will address all these issues related to health and industry and to autonomic strategy. Yeah, it's planned for the beginning of March, and I think it will be also the occasion to make some updates about the pharma strategy. So, but on this, I'm happy to take any further questions and maybe to forward them to my colleagues in charge of industry, because it's a bit, it's related to really organization issues, but it's more, you know, followed and dealt by my colleague in charge of industry. But it's planned, and we will have this event at the beginning of March. For the way you can register and participate to the event, the thing is, for now, due to the COVID situation, we are still waiting to see if this event will be physical in Paris or online or maybe hybrid. Depending on the decision that will be taken on the format, of course, the modalities for participating will evolve a bit. But I'm very happy to you know, keep in touch with you and to give you some more practical information on the way you can register. But people in Paris are very involved to organize all these conferences, and I can really contact them very easily in order to give you some further information on this. And on the event on health data, I confirm that stakeholders will be invited, which I'm not able to respond to your question today, because for the conferences, it's more our ministry in Paris in charge. So this is really the ministry which will, you know, define and see which organization will be invited. But if you are interested in, don't hesitate to send me an email so I can forward it to Paris and to see if you can be among the one which will be invited. Really, I'm at your disposal to do that.
And I suppose all of the events will be detailed on your website, presidency website, or something like that. So we can, people can look it up there. Otherwise, if they can't get in touch with you, maybe you can write to Danielle, perhaps here at the EPC, and we can try to put the things together. We'll also take a little note of the various questions that are come in during the chat function here, and maybe ask you to respond to that. There is one more about the Rare Diseases Conference on the 28th of February. Is there any particular focus here, any particular diseases, and or as a focus point, is it a question of maybe increasing research in these areas, or coordinate research, or coordinate treating opportunities for these rare diseases? I suppose not every country in Europe can have specialization in all the rare diseases, so there could be a question here of cooperating, perhaps.
Yeah, not totally. For us, it's a very important file, this rare disease file. And as I told you before, we were hoping to work on the revision of the two regulations on pediatric and orphan medicines, because we have people in Paris very involved, very engaged in this issue. At the end, we understand the working program of the Commission, and it's also logical to make a package of all these regulations and to publish this package at the end of the year. But we really want to put the light on these issues, because for us it's very important. The idea for this conference is to call the Commission to really act on rare disease. We have many different documents. We have a strategy on rare disease. We have recommendation of the Council on Rare Disease. We have many different tools, but from our point of view, these tools need to be updated. We were capable to make a big and comprehensive cancer plan, and we think that maybe the Commission could go on this way again for rare disease, and having a very comprehensive action plan on rare disease. So the idea is really to prepare the ground in order to have maybe a commitment maybe from the Commission to have a more comprehensive plan on rare disease, because so far we have very different initiatives in different sectors, in sectors related to medicine, sectors related to research, but I think this is the wish for many patients and professional organizations. I think we need something more coherent and more consistent, and this is something we will try maybe to discuss on during this conference.
Yeah, okay, that sounds good. You talked a lot about the legislative program or regulatory program related to the consequences of COVID, if I can put it that way. What about the cancer plan? You just mentioned it, and other non-related, not COVID-related diseases. Do you have any particular plans here on legislative initiatives or working on legislative? I know you're not the one who put forward the legislative plans, but you might have talked to the Commission about something here. Anything in this area that's worth mentioning now?
Yeah. On the cancer plan, of course, we are following very closely the implementation of this cancer plan, and the idea is maybe to use the EPSCO we will organize in March and in June, maybe to provide to the member state an update on the way this cancer plan is implemented. We don't expect from the Commission any legislative file within the framework of the cancer plan during our presidency. Some legislative initiative could be published, but rather in the second semester of the year. So from our side, we won't work, within the working group on the cancer plan. We will try to invite the Commission to give us some updates and to inform us on how things go on this very ambitious program. But we don't plan any more concrete. We don't plan to have any legislative files on this, because it's not ready from the Commission, and it will arrive only at the end of the year.
Okay. There is a question here, which I'll read up now. Will there be an opportunity for companies with French footprint to contribute to the presidency events? Can I reformulate the question for companies with a European footprint? But maybe also broaden a little bit to stakeholders. I mean, is there any way that input could be provided, or is the answer the same as you said about participation here?
Yeah, no, I think again I will make maybe the same answer as the one I've provided at the beginning. I'm very happy to receive any emails from you detailing how your company or a company you think about could maybe be interested in this event and could be involved, and of course I will share your interest with the people in charge in Paris, but of course the idea is really to have many people around the table in order to have very fruitful exchanges. So don't hesitate to contact me, and I will pass the message to Paris.
Yeah, okay, because this also links to the question of the global, the event about global health issues, because I think there might be people with an interest, let's say, in development areas and so on, who might want to join in for that. So the same answer would apply to that question as well. We have another one here about the health data space that you mentioned quite a lot. It says the proposal is expected April 5. Do you see any difficulties with the reserve period that will come at the same time due to the French presidential elections? I don't know what you say about that.
We don't see any difficulty. Of course, we all know and we are all aware about the fact that at the end of March we will have to. There will be this reserve period for a few weeks, but it won't prevent us from keeping on working on the technical files. And so this is really we don't plan to stop the work in Brussels. We plan to have working groups and to go as far as possible in all the texts we will have on our plate, because we think that on the technical work we don't see any obstacles to keep on working. So this is the plan. Of course, during this few weeks of reserve period, of course we won't have a lot of ministers here in Brussels to give some political impulse, but the technical work won't have any difficulties to keep on.
That sounds good. And then we'll have to see what happens after the election and who
Exactly.
the ministers will be, who comes. Mental health strategy, is there any events planned for that?
I have to check again with Paris on this, but we might have an event in January. It will be co-organized between the health ministry and the Solidarity and Social Question Ministry, because the idea will be maybe to tackle rather the issue of the impact of mental health for vulnerable people. So it will try to link these two issues, vulnerable population and mental health issues. And it can be organized at the beginning of January, but I will have to come back to you on this, because I don't have a lot of precision so far.
No, but that's fine. I mean, there are many questions, so I just asked them to see, and otherwise we can seek more information. And again, I would probably also refer to the presidency's website, if it was. There is another question about HERA. I don't know if you get tired of it now, but it's more detailed about how the member states' influence on HERA will work. The question goes directly to: will there be a board of member states there, a security committee, a health crisis board, and so on and so forth? I suppose the one way to get out of the blockage we have at the moment is to give member states some kind of influence, probably varying from the normal situation to the emergency situations. But I don't know if you can answer that question, or you have any ideas about how this is going to work in practice.
The thing is, it's a bit difficult to answer the question as the file is totally open and will be discussed again tomorrow at the Coreper. So it's difficult to give a final word on this issue of governance. Of course, it's a very significant issue for all member states, and all the discussion on the text have mainly focused on this, because for very reasonable reason and explanation, member states want to be involved and want to have a say. So this is really the discussion we will have tomorrow, and this is really the key element in order to find an agreement. But I totally trust my Slovenian colleague in order to find an agreement on this.
They're probably busy preparing that, too busy to be with us here today. So we can follow the what comes out of the meeting there tomorrow. Let me just fire a couple of questions to you as well. Is there any talk around the European Commission's new NCDs initiative? Just wondering if it's getting much traction, or if you happen to have any information to share about that. And on the subject of the cancer plan, what thoughts from the French presidency on the NCD roadmap plan announced by the Commission?
Mm-hmm. Of course, we are totally supportive of all these initiatives, and it's something we have recalled many times. We think that there are many areas where a common approach, a European approach, could really bring some benefits and some added value to everyone in the Union. So, of course, on the principle, we are totally supportive, and we just wait for the document, wait to see how member states could be involved in order to really to really contribute to this work. This is something we are calling for a long time, and we are totally supportive of any initiatives that could reinforce a common approach on health. So as I told before, on the cancer plan, again, we are totally supportive. We're just in the hands of the Commission, because the Commission is the one deciding to publish or to launch any initiative. So if the Commission plans to publish or to initiate any action during our presidency, we will be totally supportive. We have also a national cancer plan, which is very comprehensive and very aligned with the European one. So if we see any possibility to work together on this during our presidency, we will be very happy to do so.
There's also a question of whether HERA will work or establish a dialogue with the pharmaceutical industry, or if this only is going to happen through procurement mechanisms. I know procurement will be an important part of it, when it's operational, but I suppose industry is going to be involved in the creation and formation, as well as other stakeholders, I suppose.
Yeah, and actually, no, of course, if you look at the HERA decision of the Commission, the fact that the HERA entity will work with the company is very clear. And actually, through procurement mechanism, in a way, you are obliged to work with companies. So I think it's of course it's totally logical, and it's something very clear from the Commission side that all the work which will be done through HERA will be done with the help of companies, of course.
Yeah, good. And I suppose other stakeholders as well. Final question: is the presidency planning to address long-term care, healthy aging issues, maybe to events or in other ways during the presidency?
Yes, it will be addressed, but for a curious reason, all these issues around aging and long-term care are more addressed by the social team. I don't know why, because it's more addressed by the DG Emploi, actually at the Commission. So it's more tackled and addressed by my colleague in charge of social question, and I'm very happy to share maybe with you their contacts so they can respond to your questions.
Right, but I suppose this comes into the picture when we begin to talk about integration of health systems, when that is also, of course, linked to the question of prevention, and the first access to primary health care and so on and so forth, which certainly will be one of your areas. And I suppose I don't need to ask you if prevention is going to be on the agenda, because I think this is the new black, if you like, in creating creating resilient systems and so on. Constance, can you stay with us a few minutes more, or is it?
Let me check, and unfortunately not, because I see it's 11:46 and I have to leave for another meeting. So I'm very sorry to leave so early and not to have the chance to reply all the questions.
I know you have a day job to do besides being with us, unfortunately, because we could have benefited from your presence for a very long time. But thank you very much for giving the overview. Thank you very much for answering all the direct questions that I put to you on behalf of the audience. But let me also say thank you very much for the open door that you have demonstrated. The contact you can have with our audience as well in the future with the questions and whether they can join the events and so on and so forth. I don't know if there's going to be a chat function or something like that where the website, but in any case, it would be good if people can seek information how to contact there. Otherwise, try to go to us if it were, and we will communicate further on to you. We kept all the questions that came in on the chat group here, so I wish you good luck with the next meeting you have, and I wish you good luck and good health for the spring as well, and a good French election too. Okay.
Thanks a lot, and yes, I'm remaining at the disposal of everyone in order to respond to other questions or to put you in contact with the right people in Paris in charge of the different events. So I'll be happy to.
But take care with your mental health as well, because I know in the presidency there won't be much time to answer all the emails and so on and so forth. But thank you very much for the promise and being available. Thank you very much indeed,
Thanks
and also to connect to Paris.
Okay, very good. Thank you. Thanks a lot. Bye-bye. Bye.
Can I call on my colleague Emma Woodford, who is the CEO from European Policy Center, who's been there for a couple of months, I think, Emma?
Yep.
Maybe you could say 2 or 3 words about what you actually do there. But you've been writing to us in the chat function here about a debate we can have in the last few minutes here, where we have a great audience, you know, from the Brussels bubble and beyond. So Emma, what do you have in mind?
Yes, I mean, listening to first of all the wrap up from Laura, thank you, Laura, of the Slovenian priorities, and from Constance. I'm obviously, both of these presidencies have been working in response to the emergency situation and looking at where the European Union can give an added value to health in terms of procurement or in terms of emergency powers. And I'm listening also more and more within the health community. We're talking about focusing on resilience of healthcare systems. How are healthcare systems managed across different member states within Europe, and how has this affected health outcomes, but also COVID outcomes, and how strong are our healthcare systems prepared for the future? But of course, the question of competence always comes up in one's mind. Then, healthcare systems are traditionally the member state competence. But if we look at the European Beating Cancer Plan, that actually has quite a heavy investment in getting member states to work together. The comprehensive network of comprehensive cancer centers, for example, is one case in point. And could we see this working in other disease areas? It's too early to tell, I feel now, whether the European Beating Cancer Plan is being a success in this area. But I think the fact that it's there and it's underway is quite revolutionary. It's quite groundbreaking for health in Europe. So really my question to everybody in this room, and please consider yourself to be in the room rather than simply watching for this particular event. I'd very much like to hear your opinions about what Laura has said, or Constance, or these questions that I'm throwing out here. We're at a crucial time now. What is the future of health in Europe? Are we going to go back to business as usual, or do we have opportunities to collaborate more? How far will that collaboration go? So I'm very keen to hear people's opinions.
I think it might also matter in the sense of getting ideas for the work program for next year at EPT, if there are things we can pick up. But let me also just say that I think the sensitive area here is what should Europe do, because during my long life here with the health policy at the European Union, it's always been keep your hands away, or at least have a reduced role. But as we all can see, this has changed a lot with COVID. But the question is, are people worried about too much European influence here, and how can it best be administered in order to create a more resilient sort of European health system? I think is what you're asking about. Where would we get the answers to that? If anybody in the audience would like to answer, would that be on chat function? Or the Q&A?
I think we're inviting people to unmute themselves. To maybe raise a hand. I could see if hands are raised in the participant list. Or to put a question.
If you can wait, then maybe I have a very direct question to you, Emma, because I think your accent actually tells where you come from, and probably from the UK. Do you have a feeling of any discussion about these issues there in after Brexit? Is there any feeling that that the UK might want to join, let's say, also emergency procedures and so on and so forth, or is it just out of the question now?
I think, given the current the current government, I think they're not looking towards the EU at all on this particular question, and I don't think that the EU-UK relationship, even if they were, I think the big question would be, would the member states be willing for them to join, given that they chose to leave? I say they because I'm more Belgian than British these days, despite my accent.
Yeah. Right. I'm not sure can you see if anybody wants to intervene here? Or maybe people are getting a bit afraid of us asking them to, but there's a platform now that you can use to talk. You could better see than I can, Emma, so anything coming up?
No, I don't see any questions or comments.
No. Right. Anyway, I noticed all the events there from the French presidency coming up, and there was this issue of resilient health systems, I think already in January, where people will go together with their different backgrounds. I mean, we can say we have different health systems in Europe, but we also have, you know, a lot of uniformity in the health systems because they're all in principle, you know, public with other, not public payment, you know, solidaric financing and equal access more or less for all. So let's see what comes out of that. But we are also going in the beginning of next year to discuss this on the basis of the health at a glance, together with the Commission and the OECD and the European Observatory. So that might be a place where people would like to rejoin us as well. We'll come up with further news in the beginning of the year, but I think the focus here will also be about how can we actually work together to strengthen our systems instead, as I said before, of reinventing the wheel, as we have a tendency to do, all of us, all the time.
Yep.
So we will come back with news about that later on. But it doesn't seem that we can tempt people, you know, to join in, and we can have our own opinions. But I'm not so sure that this is what people really want to hear. So if there's nobody around there, I think I will end the program here for today. Looking back to what we heard about this past 6 months, and looking ahead to, I think, a very intensive spring here with despite the French presidential election, but also having a very strong French EU presidency program with a lot of interesting things that we can follow up on. So any final comments from you, Emma, before I wish people a good day?
No, I'd just like to say, everybody, thank you for attending, and very much looking forward to seeing everybody at this event with OECD and DG Santé and the Observatory.
And then let me also thank everybody for being around here. We can't really apologize on behalf of the busy health attachés of the time they could spend with us, but I think and hope it has been useful at least to hear the summary of the Slovenian presidency, but also the engaged, I would say, presentation of what the French have in the pipeline for us. So I think this is the last chess event for this year. At least something strange should happen if we have more. So let me also thank you for this year. We've been meeting quite a few times. I hope we will again next year. So I wish you also good health during this spike, third, fourth, fifth spike, depending on where we are. But again, this new Omicron variation, take care out there, and make certain that you also do that during the festivity periods here by the end of the year. So I wish you good luck, and I wish you a very happy new year, and see you again in the beginning of next year. So thank you very much for today. See you next year. Bye-bye.
Thank you, Hans.